Hey, Dr. Pajek.
How are you, Ashley?
I'm good. I'd like to ask you, what are some things patients aren't sharing with their psychiatrist that they should be?
Yes, it's a great question. The first thing, I have three kind of categories. The first thing would be substance use. Many of my patients will be coming in feeling worse, and they won't tell me about their substance use. So what that looks like is somebody may have been drinking for 2 or 3 nights in a row on vacation. They come see me on a Monday or Tuesday morning, and they're telling me how bad they feel, but they haven't told me the quantity that they've been drinking. And I'll even ask them, but they might be reluctant to tell me. That's one thing. The second thing will be things like marijuana use. It's higher than they're telling me, or they're smoking during the day. It may make somebody look like they have ADHD or like functionally depressed. Um, Aside from that, if anybody's using any opiates like pain pills, that can make them have withdrawal if they stop taking them, and they won't tell me they're in withdrawal, but they have lots of anxiety, and that could potentially be a dangerous situation because I might prescribe something that won't fix the problem or might worsen the problem. So the number one thing is tell your psychiatrist about the substances that you're using, even if it's caffeine. I think that's important for us to know about that as well, or any other prescribed medications that they're getting from other doctors, especially. Um, the second thing I would mention that patients are not asking us, but they should, um, or they're not telling us, but they should, is that they're not taking their medication as prescribed. Many folks will miss a few doses of their medication per week, or they've rationed the medication and they're on a lower dose, and they should really tell us that. They always think I'm going to be upset with them, or they'll say, I know you're going to be angry with me, not because I've been angry with them in the past. They just think that that's what's going to happen when they tell a doctor that. And my response is always like, no, that's okay. That makes much more sense to me that you're not doing so well. Because if your doctor doesn't know it, there's a chance I might switch you to another medication that you don't need to be on. Um, it also might look like you have treatment resistance to medication, which puts you in another category of illness than not. So always tell your doctor if you are taking the medication. If you're missing it, that's super important. The third thing I would say is patients don't ask me enough about their doubts about the medication or about the treatment plan. When I prescribe a medication, there's something called informed consent where I have to say, listen, Bob, you don't have to take this medication that I'm about to prescribe. You could say no. You could take another medication. Also, if you do take this medication, there are risks and benefits to it. These are the risks. It's assumed that the benefits, that it's going to help their depression or anxiety, which I do explain, but the risks need to be discussed. And so I will talk to a patient about this. It's often at the end of the session, once we've gathered enough information, and then they won't ask me all the nooks and crannies of thoughts that they may have, or they might go home, not start the medication, and when they come back the next time, they might kind of underreport whether or not they took it. So my thought is, I'd love to hear questions from patients. I always hear from them, Doc, I'm sorry, I Googled the medication. And I'm like, hey, bring it on. Like I can spar with Google on some of this stuff. You're paying me a lot of money for expert advice. Let me tell you what is true on the internet, what's not, because the internet can obviously is a wealth of information. It can be very helpful for patients to learn about what they're taking, unless they're on Reddit and they have incomplete information from people that took these medications, if that makes sense. So, again, it's substances, adherence to the medication, whether they're taking it or not, and then also ask questions about the medication if you have doubts about it. That should be processed with your doctor, and they should be able to field those questions. And if a doctor ever says you just got to take it or something, like you don't just have to take it because you're really in control of your body and what you're putting in your body. The only caveat I'll say to that is I have patients who want me to decide about the medication, or they want me to steer the treatment plan a bit more for them. They don't want to read about it a lot. And so sometimes I'll take a more active role in saying, well, in my gut, I think this is in your best interest. But usually the patient should just decide that, initially. Yeah.
Okay.
And if anyone found this helpful, yeah, go ahead.
All right. Do you have any advice for patients who are afraid of disagreeing with or disappointing their doctor?
Yeah, disagreeing. I mean, disagreement to me is more of like someone's preference of what they want to do. And disagreement can sometimes lead to a fracture in the relationship because someone might want to do something what I would think was dangerous. They may want to take a medication with another one that I'm prescribing, but they're getting the other one from another doctor, and I won't like the idea. I think it's dangerous, and I'll say, I don't think we should do this. And that's a disagreement. And doctors have a right not to prescribe things they think are going to be dangerous. And I'll explain that to patients. But it depends on what the disagreement is. If the disagreement is, doctor, I don't want to take the Prozac because it's going to affect my libido and I don't want to disappoint you. I don't get disappointed by a patient not wanting to take a certain class of medication. I get disappointed when I can't get Smashing Pumpkins tickets to a concert because I waited to the last minute. You know what I'm saying? I mean, that's like a disappointment to me. Otherwise, I'm not rattled by that. I would encourage the open conversation about it because it leads to more trust between clinician and patient.
All right, excellent. So share everything, be open, be honest with your provider. It's the best way they can help you.
Right. And if folks are listening out there, click the bell and the like the video as well. And if you ever want to work with us, our website's atlaspsychiatry.com.
All right. Thank you, Dr. Pajak.
Thank you, Ashley.